I'm Dr. Kelsey Brenner. I'm one of the lead clinicians here at Neurologic Wellness Institute. I practice clinical neuroscience, and I also received my health coach training through Duke Integrative Medicine. I specialize in QEEG assessments and neurofeedback, and I mostly work with adults and children with mild traumatic brain injuries, ADHD, anxiety disorders, various neurological conditions, and that's what we specialize here. I was exposed to clinical neuroscience after interning under Dr. Ted Carrick in Atlanta, Georgia. And through that, I was exposed to hundreds of different patients with varying different neurological disorders. I learned under some of the best different doctors that could travel from all around the world. And through that experience, I was able to see kind of another approach to different neurological conditions that I wasn't exposed to prior to that. And based off of that, I was hooked after that. Clinical neuroscience takes the evidence-based research on all different types of neurological therapies and applies that into clinical practice. So we address the whole nervous system. Our initial evaluation is about 3 hours long. We look at cognition, visual perception, balance, all different areas of the nervous system to see how well they're performing. Based off of that evaluation, we can then see which areas are working really well and which areas need a little bit of improvement. Our therapies are designed based off of that evaluation. So every person gets a very unique treatment approach designed to strengthen those areas that may be a little weak. So clinical neuroscience really focuses on the root cause of a problem, and we often hear that everyone's looking for the root cause. But when you look at a condition, there can be varying symptoms. When you focus just on those symptoms, you may not be really looking at exactly what's causing those symptoms. For example, if you look at stroke or maybe a child with cerebral palsy, they could have a very spastic limb. Say their arm is stuck in a certain position, and it may look like the muscle's causing that problem, but really it's the brain that's not giving the correct signal to that muscle. So you can stretch that muscle all day long, but if you don't address the root cause, which is a brain issue, then you're only going to get so far. I first learned about micronutrients at a conference when I heard Bonnie Kaplan speak. She spoke about her research with micronutrients, working with different patient populations through brain development, but then also through different mood disorders. And it was super interesting and also just made complete sense. Micronutrients are the basis of so many systems in our body, and we need that to become healthy. A lot of times our food sources aren't very nutritionally dense. And so focusing on a very high quality micronutrient to help supplement that, you can get great results with patients. I was first exposed to Hardy's Daily Essential Nutrients after learning about them through a conference through Bonnie Kaplan. I was looking through just general micronutrients, and Hardy's was the ones that had the best research behind them. And like with anything, I like to try it on myself first before I give it to my patients. And so I started taking them and saw great results. I was in graduate school at the time, very emotionally, mentally just drained, working really hard. And I could eat all the nutrients through my food as much as I could, but I really wasn't getting what I needed. And so through taking Hardy's, I saw great results. Mental clarity, emotional stability, just could kind of handle my workload a lot better. And I realized that would be great for my patients as well. I always like to focus on lifestyle factors first with my patients. Making sure that their stress levels are down, trying to get nutrients from food as best as they can. But multiple factors kind of limit that. Our food supply isn't as nutrient dense as it should be. And also incorporating really healthy foods can be very difficult for patients, especially if they haven't done that in their life before. And so oftentimes we need to resort to a micronutrient such as Hardy's to really supplement that and bring them back to where they need to be. Patients have experienced a wide variety of changes using daily essential nutrients. I would say the biggest ones would be mental clarity and emotional stability. No matter what they come in with, whether it be a mild traumatic brain injury or children with ADHD, anxiety, a lot of times there's an instability there. They feel a lot of brain fog, difficulty focusing, and a lot of times emotional instability as well. By giving these micronutrients, they're able to resupply and supplement with what they need for their vital functions in their body. And the biggest feedback we get is just mental clarity, calmness, and emotional stability. When patients first start taking micronutrients, they may notice some changes right away. I often like to say that it may take a few weeks, and research shows it could take up to about 8 weeks of consistently taking them to see larger results. But they usually notice changes in mental clarity, just feeling like they have more energy, and better emotional stability as well. The most common symptoms that we recommend using micronutrients for would be brain fog, anxiety, different mood disorders, and a lot of times with children with ADHD, those micronutrients are a big piece of the puzzle that they're missing. My patients who have made lifestyle factors and have also incorporated these micronutrients into their daily lives, I've noticed that the results that we get with our therapies here in the clinic just last a little bit longer. They come on sooner, and they just feel more stable. They're able to think clearer. They can interact with their families better. They can go to Thanksgiving and family holidays and not feel very overwhelmed because they have the nutrients that they need to get through it. They're not getting too fatigued. And so we do see that, and we see just better and faster results with that. When looking at any type of supplementation, I always want to look at the quality. And so when I started looking into micronutrients, I wanted the best quality. Hardy's micronutrients have the best research out there. They've really been shown to have a big impact, and they're very bioavailable. So you want the patient to be able to actually use the supplement that they're taking. Oftentimes patients can pick up a supplement from anywhere in the store, and they're actually not absorbing those nutrients. The research has shown that Hardy's micronutrients has great bioavailability and can be absorbed for the patient, and so that's the best quality that we can give to them.
My name is Dr. David Traster. I'm an owner of Neurological Wellness Institute. We employ 10 doctors who specialize in neurologic disorders such as concussions, dizziness, dysautonomia, mood disorders, cognitive disorders, developmental disorders, and neurodegenerative disorders. So clinical neuroscience is just translating the most up-to-date research into clinical practice. So we're able to perform those up-to-date evidence-based diagnostics and treatments for our patients with neurological disorders. All of our doctors are very well trained on really evaluating different areas of the brain and nervous system, and whether it's a brain area or a brain network. Many times people will come in with pain in the arm, or a movement disorder, or brain fog, and it's really our doctor's responsibility and training to really understand why do they have those symptoms and what we can do to help them in their everyday life. My first exposure to Hardy's Daily Essential Nutrients was about 4 or 5 years ago. I spoke at a neurological convention with Dr. Popper, Dr. Kaplan, and Dr. Ruckledge, and through their clinical experience and through their research, it was really an eye-opening experience for me because I was unaware of Hardy's Daily Essential Nutrients, and I was really impressed with really the quality of their nutrients. I recommend Hardy's Daily Essential Nutrients because we've tried a lot of different companies, a lot of different products, and what really stood out is the evidence. Most companies have no evidence that their product is effective. And what really stood out to me is the bioavailability. Many times people will take a supplement and they assume what they're taking is being absorbed in their body. Many times that supplement never gets absorbed, and because of that, they're never able to use what they think they're taking in, and it turns out to be just wasted time and wasted money. Hardy's Daily Essential Nutrients really gives a big impact because it's bioavailable, and it's very easy to take and easy to use, and people feel an impact right away. When we give our patients Hardy's Daily Essential Nutrients, we see pretty soon people start to feel a little more energy, a little improved mood, a little more stable, and within a few weeks, people really are amazed just how calm they are. Some people have mood swings, they don't feel as moody anymore. Overall, we've seen depression and anxiety improve, huge improvement in cognition and memory. Overall, within a few weeks, let alone a few months, people just love us because they love Hardy's Daily Essential Nutrients. For patients that we believe really could benefit from Hardy's Daily Essential Nutrients, the first is mood disorders. We understand that mood disorders are a huge problem in the world. We also understand with neurodegenerative disorders, neurotraumatic disorders, if you have a mood disorder with that, the outcomes are much less and it's much harder to treat. So we typically use the Daily Essential Nutrients for anyone who has anxiety, depression, agitation, sleep issues, tired and fatigue, cognitive memory disorders, and these are the things that really found benefits for using Hardy's Daily Essential Nutrients. So when people take Hardy's Daily Essential Nutrients, we find is at that dose and at that bioavailability, It really gives the body and the brain all the nutrients, all the minerals, all the vitamins they need to not just survive, but to thrive in their everyday life.